My name is Dr. Ken Alleyne, a sports medicine and joint reconstruction surgeon. And we have a series of videos that we're going to discuss some of the more common things that we see here in my orthopedic surgery and sports medicine practice. By way of background, I am a board-certified orthopedic surgeon. My training has occurred at many places around the country, including Williams College, Medical School at Wake Forest University, Howard University Hospital for residency, Yale University for my sports medicine fellowship, and then a research fellowship at Harvard MIT in Cambridge. The majority of my practice are problems of the knee and shoulder, and our practice here at Eastern Orthopedics and Sports Medicine ranges from school-age kids to active seniors, professional athletes, collegiate athletes, and Olympic athletes. So we have a pretty diverse practice. What we'd like to do today is discuss a series of the more common things that we see in hopes that it will help to direct our patients in their care to ask the appropriate questions of their doctor and to make sure that they have good information in regards to their orthopedic concerns. Rotator cuff impingement. Often that will be called a bone spur in the shoulder. It will be called a pinched shoulder. It will be called a rotator cuff injury. Generally, this is a diagnosis in the shoulder of pain with overhead activity, pain with lifting, pain with reaching, sometimes pain at night with sleeping, that is not quite a rotator cuff tear, but is still nonetheless a very painful and significant problem for millions of patients every year. We see these patients all throughout the year, but as the spring moves into summer and people tend to be more active, they often tend to complain of this diagnosis more. Generally what happens is, unlike a rotator cuff tear where there's actually a full tear through the tissue, with rotator cuff impingement, often a bone spur pinches down on top of the rotator cuff, which is the tendon that inserts on the ball of the ball and socket joint of the shoulder, causing a partial tear or inflammation within that tendon. Your surgeon will diagnose this with a series of physical examination, often doing things like injections in the shoulder or utilizing medications to help treat, and of course, when required, physical therapy to help strengthen the shoulder and provide stability to the shoulder, as well as the many other things that physical therapists can do that you simply can't do on your own, which are very important to your recovery. Rotator cuff impingement syndrome is on a continuum or a pathway that can lead to rotator cuff tear. So when patients have these shoulder issues, it's very important that you consult with your orthopedic surgeon early in the process. Early in that process often allows us to prevent a rotator cuff tear from occurring or make it less likely to occur, and certainly to be able to treat this problem non-operatively that can often become an operative problem down the road. There are many cases of impingement, though, that do require surgery, either because there's a partial tear of the rotator cuff or the pain simply will not go away and the dysfunction simply will not go away with non-operative treatment, such as we noted before, anti-inflammatory medications, injections into the region, and physical therapy. The goal of this treatment is often to remove the offending problem, often a bone spur in the shoulder, to address and clean up any frayed or torn edges in the rotator cuff, and to hopefully, again, prevent a full-thickness rotator cuff tear from occurring. Generally, patients, at least in our practice, are in a sling for 1 to 2 days after this procedure, and we get them immediately into physical therapy and hopefully restored back to a pretty active lifestyle soon thereafter. The goal, again, of arthroscopic surgery being done through very small incisions, surgery that's done underwater in a same-day status, allows our patients to recover relatively quickly and to resume their normal lifestyle. The goal of rotator cuff impingement surgery, as we noted before, is hopefully to fend off against the possibility of a full-thickness rotator cuff tear, which is a much more significant surgery requiring a longer operative time and longer recovery. Rotator cuff impingement surgery is a very common surgery in the United States and around the world with excellent outcome. Certainly, if you have any other questions, please don't hesitate to visit us at www.eosm.net.